If it can clear, if it can, whatever it's generating new blood vessels, or whether or not it's clearing old blood vessels, will that have the same effect on other, like, I mean, theoretically, can we see this maybe as an advance for peripheral artery disease or even coronary artery disease at some point in the future?
Very, very interesting question. So I have actually treated patients already with peripheral arterial disease with the Shane shockwave device. And I'm doing that because there is literature from Europe that it can be effective, and small number, but very safe procedure. It's basically almost an ultrasound type procedure, and there's no X-rays involved, there's no needles. In Europe, that device shaking the chest, shock waves to the chest, is approved for people who've had a previous heart attack and damage as a regenerative, restorative, stem cell releasing stimulus to the heart muscle. So it's unheard of in the United States, but perhaps 25 research studies from Europe that preceded the use for sexual medicine are very provocative to me. And if I can get the right resources, I'd love to have it available for patients. It should be at major medical centers. It's not reimbursable. There's no FDA approval. But if you've had a heart attack and your doctor says you're damaged, a lot of people would be interested.
Yeah, happy to spend the money.
A non-invasive, reasonably proven way.
Gotcha.
So that's exciting.
Is that just out of curiosity? Is that a hermetic response? Is it a stress response, a healing response that's causing it to provide this improvement?
The biology of shaking a tissue causes micro trauma, and that induces, you could call it hormesis, what doesn't kill you makes you stronger. That the healing phase generates new blood vessels, nerve growth, stem cells, nitric oxide, kind of the big four win we'd hope for. But we can do it mechanically. That's just insanely interesting.